Hi, I am Alison Lindauer. I am a nursing student in nursing school at VUJC in Jasper, Indiana. I am in the ASN RN program and I will be beginning my second year this fall in 2021. Today, I will be talking to you about Impetigo. First of all, what is Impetigo? It is a common, highly contagious bacterial skin infection. It commonly occurs in children ages 2 to 5, but anyone can get impetigo. Children who have other skin conditions like eczema, atopic dermatitis are more likely to develop this as well. It's more common in the subtropic or tropical areas. Scabies can increase the risk of infection, as well as living in crowded conditions, as well as being involved in activities that allow you to get cuts and scrapes more often. Characteristics include red, itchy sores. The genus is Streptococcus. The species is Streptococcus pyogenes. Causes, it includes one or both types of bacteria. In infants, it is called Staphylococcus aureus. And for children or those who are older, it's group A Streptococcus, also known as group A strep. Treatment includes the oral and topical antibiotics, which usually a doctor prescribes. Next, I will talk to you about the characteristics. Some first signs that you will see to indicate impetigo include red, itchy sores, and they're on the skin. They're usually in the cluster around the nose or the mouth, as you can see in this picture at the top. They will also be found on arms and legs, and I have a picture of an arm here at the bottom. The red sores can also be on the hands and the feet as well. And it affects the exposed skin. Sores will rupture. They'll ooze a clear fluid or a pus in a few days. They form a yellowish brown crust. It's called a honey-colored scab. It usually heals, and usually there is no scar. For 10 days, it takes for that sore to appear after you expose to group A strep. Mild itchiness, soreness, swollen glands may occur. There's 3 forms that I will talk about in the next 2 slides. The most common one is non-bullous. One that is less common is bullous. And ecthyma is also less common, but it's more severe. So let's talk about non-bullous impetigo. I have 2 pictures here that show what it looks like. It is the most common. It's 70% of the cases. It's caused by Staphylococcus aureus mainly. It usually follows a skin injury or disorder, or it could come from a secondary bacterial infection of another infection, like I mentioned earlier, atopic dermatitis. It starts with these red, itchy sores, again, around the mouth, around the nose. They go from papules to vesicles to painless pustules, and sometimes you'll see this narrow red border around them. Then the sores will break open. They'll leave irritated and red skin. Next, you'll find this brownish, yellowish crust, or the honey-colored crust that I spoke about earlier, and it has an ulcer-looking base. The crust eventually will heal. The reddish spots will fade, and it doesn't leave scars. And you can see here how this one, you can see some of the honey-colored crust on that picture. There is a limited amount of treatment for non-bullous impetigo, but one thing you can use is mupirocin ointment. For numerous lesions, they usually try the first generation cephalosporins, clindamycin for MRSA, and another technique that I learned when I researched was you can use a cool compress to just remove that crust 2 times daily to help with the healing process. Now let's look at bullous impetigo, which is on the top left, and ecthyma on the top right. Well, bullous impetigo and ecthyma, they are both much less common. But with bullous, you get these red macules, these blisters, which they also call bullae, on the skin, and there's a red base. The size can be from millimeters to centimeters, sporadically occurs, and it develops on intact skin. And you can see these blisters on the trunk of this infant, and this happens on infant and young children, where they also fill with this clear fluid. They become dark, cloudy, and the blisters that start on the unbroken skin are usually not surrounded by the red skin. They become limp, they become clear, they burst open, then a yellowish crusty sore forms over the area. They usually do not leave scars when they heal, and they're caused by Staphylococcus aureus bacteria. Treatments include oral first-generation cephalosporins, like I mentioned in the non-bolus, and good hygiene. Now we have ecthyma, and you can see in this picture, this one is more serious because it penetrates deeper into the skin. It's painful, and you do have the fluid or pus-filled sores. It has a thicker crust on it, and it's usually on the buttocks, the thighs, the legs, your feet, your ankles, and often around there you'll see redness, and it turns into deep ulcers, which these can leave scars, and they heal more slowly. It happens when impetigo, it goes untreated, so it's important that you get impetigo treated immediately. Adults, those with diabetes, those who have weakened immune systems, they are more likely to develop this as well. So treatment for ecthyma is usually oral antibiotics that is prescribed by a doctor. Now I will talk to you about the causative agent of impetigo. So what happened is someone becomes exposed to one of these bacteria. You have the group A streptococcus here on the left, or group A strep, and then Staphylococcus aureus here on the right, which usually or does occur in infants. The outer layer of the skin or epidermis is infected. It begins because you have a minor cut, you get bit by an insect, or you have a rash, like eczema, or just broken skin, and this is called secondary impetigo. It can also occur on healthy skin, which is primary impetigo. Skin-to-skin contact is a way you can get impetigo, as well as touching items of the infected person, which include towels, clothing, and as well as toys. So treatment methods, which I mentioned a few in the other slides with the types of impetigo, but mupirocin ointment or Bactroban or Centini, which is on the top left here, usually that is an ointment used where they put it on the small areas on the skin where there's small sores, so they can apply it directly to those areas. Now, retapamulin ointment or Altabax, which is right on the top here in the middle, this one is applied 2 to 3 times a day for 5 to 10 days. So it helps clear up the impetigo in a few days. And it also decreases the time someone is contagious. So this one's important for that. Another way you can treat impetigo is to soak the affected area. They suggest warm water or a burl solution or using a cool wet compress just for a few minutes to remove those scabs, those crusts, before you apply these ointments at the top. And this way it allows the ointment to penetrate into the skin. And you can also have a non-stick bandage on hand to put over the area so they prevent the sores from spreading. Now, if you have severe or widespread impetigo, there's a lot of sores or ecthyma because it has gone untreated, they usually prescribe oral antibiotics, in which I have 2 here on the top left and then, or the top right and the far right. You have amoxicillin, augmentin is a good one, certain cephalosporins, clindamycin. These also help stop the infection from being contagious 24 to 48 hours. Oral antibiotics have more side effects like nausea, so that is the downside of that compared to using just the ointments. But treatment, all in all, the goal is to help heal the impetigo, in about 7 to 10 days. It can take longer if you have another underlying infection or another skin disease. There are complications that can occur, but usually they're rare. They occur about 1 to 2 weeks after your sores go away. Adults are usually at a higher risk, and as you can see here at the bottom, here's some complications that they can experience. I want to start coming to the end here, and before I do, here's a case study example. So I found this online from Haynes and Linwood, and they had this 5-year-old male. He presented with golden yellow crusted lesions behind the ears and mouth. He had frequent nose picking and discharge from the lesions. He had the characteristic honey-colored crusted lesions at the angle of the mouth, around the nose, and behind the ears. The lab results also showed gram-positive cocci in chains, B. hemolysis seen on the blood agar. So all of these led to the diagnosis of impetigo. So then they knew what this 5-year-old had and how to treat it. Lastly, I want to end with some key points or takeaways to take with you about impetigo that are very important. To know first and foremost, it is a bacterial skin infection. Red, itchy sores is a common characteristic. It's common for those ages 2 to 5. It's caused by Staphylococcus aureus in infants and group A streptococcus in children and those who are older. Treatment is oral or topical antibiotics. Hand washing is very important. This helps protect others and yourself from future exposure. So having hand washing at the forefront of what you do is very important. Also, proper care of wounds. You want to clean those minor cuts and injuries with soap and water. Clean the drainage, or if there's open wounds, use clean, dry bandages. Hygiene, again, very important. To wash those infected items daily. Like I said, hand washing, but also cough and sneeze etiquette. You can leave lesions open to air. It may aid in the healing process. A child can attend school during treatment, so that is important to know. If you are considered contagious, in the hospital, they'll put you in contact isolation. But from school, like I mentioned, it's not necessary that you remove a child from school or daycare unless they have widespread lesions or they are actively weeping. So, and also a big thing to push is to avoid sharing those personal items when contagious. Prevention. Prevention is key. And the biggest thing I want you to take away from this is make sure to clean the items, clean the wounds, clean the sores, hygiene, hand washing, keep those nails short and treat those cuts. This is very important in the treatment and care of impetigo that occurs. And then here are my resources. I went to the CDC and a lot of other websites, and I found all my pictures and things on Microsoft. Thank you for your time, and I hope you enjoyed this presentation. Thank you.